Hi, I'm Neil Summers from Moonstone. We are faced with the Covid-19 pandemic, unprecedented in living memory. With the national lockdown looming, I discussed the pandemic and our tech responses to it with Ryan Noach, CEO of Discovery Health. We're 3 months into the pandemic. What do we know about this disease?
Neil, the truth is that, as clinicians and in medicine, we really rely on evidence, and we're in an unfortunate position here of dealing with this novel coronavirus, novel meaning new. And so we don't have much evidence. What we know is that this is a coronavirus, which we're aware there were 6 others, and this is the 7th coronavirus that we're aware of. It's spreading quickly. It tends to cause mild or asymptomatic disease in about 80% of people, and maybe even more than that. There is emerging anecdote of lots of people who were completely asymptomatic who are now testing positive. They probably didn't even know that they had the disease. Somewhere between 15 and 20%, quite a severe disease, severe respiratory illness. That seems to affect predominantly the elderly and people living with chronic disease.
What do we know about the stages of the disease?
The incubation period is reported in the literature to be 2 to 14 days. Now that's not really helpful because that's a very long period of time. And what we are seeing anecdotally and what most countries are reporting now is something like 4 to 7 days. The early symptoms tend consistently to be a fever in about 80% of people. A lot of people are reporting fatigue and malaise, and the majority are also reporting a cough. And it's quite a typical cough in that it's a dry cough or non-productive with a sore throat. You speak about the phases of the disease. Quite early in the disease, they develop shortness of breath. And anybody who does develop shortness of breath should seek a health professional advice or go to a hospital straight away because it seems to progress quite quickly from there.
And here are some further precautions to prevent infection. Stick to South Africa's lockdown rules. Make it a habit to wash your hands. Have the flu injection. And shop only when absolutely necessary. What are the myths surrounding the virus? What should we take note of? What shouldn't we take note of?
We created an information hub on the Discovery website. You can just log into the Discovery website. And it has become a very useful single source of relevant real-time factual information. Firstly, if you have been confirmed to have an infection, you should be wearing a mask at all times. And the reason is because those masks catch saliva droplet spray, and they prevent you spreading these little viral particles that we spoke about earlier adhere to surfaces for extended period of time. The other group that really does benefit from wearing masks are healthcare workers.
It's definitely not business as usual. What are the workarounds?
We're really focused on the digital health solutions at the moment that achieve 2 things. The one is they protect doctors by allowing them to engage through virtual consultations with patients. And the second is that they provide a very accessible consultation service to patients. So wherever patients are, if they have access to a smartphone or a web-enabled device, they should be able to access good virtual consultation or a doctor advice via a smartphone link. We've got this built into our Discovery app.
There are a host of options to work remotely. For the past couple of years, Moonstone has been distributing Sweetbox, an online video meeting and signing platform. Sweetbox allows you to securely interact with your client, agree on meeting outcomes, digitally sign documentation, and adhere to all compliance requirements. Further information is available on the Moonstone website.
Now, my advice to financial advisors right now would be to be doing video consultations and use simple technology, video calls, whatever platform you prefer. Use video technology for those consultations and discussions at the moment. And there's probably no more important time than now for good financial advice.
Ryan, thank you very much. Let's see what we can do together to overcome what is going to be a very trying time.
And I think just, Neil, to end on a reassuring note, I think 2 parting messages from me. The one is to say simple preventive behaviors and habits have been demonstrated conclusively to contain the disease. And you just have to look at the performance of Japan, South Korea, Singapore, China. So be very vigilant and be prudent around those things. And the second message is rely on fact. Stay calm. Be assured we will come out the other side of this and be safe.